Hi, I'm Dr. Rahi Victory, and today we are going to talk about the top 5 vitamins or supplements that you can use to improve your fertility. So, for the vitamins that you can use to improve your fertility, if we're talking about getting pregnant using IVF, and we're talking about a patient that does not have endometriosis or something significant like polycystic ovarian syndrome, here are the basic ones you can use to improve your outcomes. Number 1, vitamin D. Studies are very clear that vitamin D has an enormous impact on your success in getting pregnant. The more vitamin D that you have, that's closer to the normal range, you don't want to go over in excess, the better your outcomes are going to be in terms of successfully conceiving and also in terms of reducing miscarriage. As recently as a couple of weeks ago, a study was released demonstrating that patients with low vitamin D have a higher rate of miscarriage. So simply correcting your vitamin D levels is very important. It's an easy test to have done. They can test it in your blood, and there are multiple formulations of vitamin D which can be taken to improve your success. Number 2, you need a good prenatal. Check out our video with the link right here called The Good, the Bad, and the Prenatal, where we compared several different brands and the contents of each brand. So there are lots of different prenatals. You can check those out, but you definitely want one that has as many and as much of each of the daily recommended vitamins as possible. There are numerous different formulations. Find one that's right for you and that settles with your stomach well as well, because that's also an important part. Number 3, fish oils. There is more and more evidence coming up all the time that the fish oils, also known as omega-3 fatty acids, can be particularly useful in quelling or decreasing inflammation in your body. The less inflammation you have, the higher the chances you're going to get pregnant and stay pregnant. More and more studies are coming out suggesting that these can be very important in terms of your success. Number 4, melatonin. Something that most people don't know about, but melatonin during stimulation for a frozen embryo transfer will have a very significant increase in your chances of success, usually up as high as 30% more than the patients that did not take the melatonin. We're not quite sure if it's because it helps you sleep better, and we know that sleep's really important for your IVF, but at the end of the day, we do know that patients that took the melatonin did better. It has absolutely no side effects, and for you, that's going to be a good thing to help improve your success rates with no compromise to you. And lastly, iron. There are studies coming out now that suggest that women that have low levels of iron will have a decrease in their success rate. By taking iron, you'll improve your success rates and potentially reduce your chances of miscarriage. And it's also really important once you're pregnant, because your baby or babies are going to be very, very effective at sucking up all the iron that you have in you. And then if you're deplete, you'll start feeling tired, fatigued, and very kind of slow and lethargic, and it makes it for a much more challenging pregnancy. So by keeping your iron levels high from the beginning, you're going to help yourself not just get pregnant, but have a more comfortable pregnancy. The other medications that we talk about but aren't quite supplements are aspirin. Aspirin can be very useful, and progesterone as well. So those are things you need to talk to your fertility specialist about, but are easy to take, relatively easy to find, and have very few side effects if taken appropriately. Make sure you click that subscribe button if you want to learn more about fertility, and comment to us about what vitamins you're taking and how they settled with you and your fertility journey.